Let's dive into some key MCQs on chronic suppurative otitis media, or CSOM. Question 1. Which part of the ear is primarily affected in chronic suppurative otitis media? A. Inner ear B. Middle ear C. Outer ear D. Cochlea. The correct answer is B. Middle ear. Question 2. The most common causative organism of CSOM is A. Streptococcus pneumoniae B. Pseudomonas aeruginosa C. Staphylococcus aureus D. Haemophilus influenza. The correct answer is B. Pseudomonas aeruginosa. Question 3. A key feature of CSOM is A. Pain in the ear B. Persistent ear discharge C. Sudden hearing loss D. Ear itching. The correct answer is B. Persistent ear discharge. Question 4. Which type of tympanic membrane perforation is most commonly associated with CSOM? A. Marginal B. Central C. Subtotal D. Attic. The correct answer is B. Central. Question 5. Which complication is most commonly associated with CSOM? A. Meningitis B. Facial nerve palsy C. Cholesteatoma D. Labyrinthitis. The correct answer is C. Cholesteatoma. Question 6. The recommended initial treatment for uncomplicated CSOM is A. Systemic antibiotics B. Topical antibiotics C. Antifungal drops D. Surgery. The correct answer is B. Topical antibiotics. Question 7. Which surgical procedure is often performed to treat CSOM with cholesteatoma? A. Myringotomy B. Mastoidectomy C. Tympanoplasty D. Stapedectomy. The correct answer is B. Mastoidectomy. Question 8. In CSOM, the hearing loss is typically a sensorineural B. Conductive C. Mixed D. Fluctuating. The correct answer is B. Conductive. Question 9. What imaging modality is commonly used to assess complications of CSOM? A. X-ray B. CT scan C. MRI D. Ultrasound. The correct answer is B. CT scan. Question 10. The presence of oral polyps in CSOM indicates A. Active infection B. Healing C. Eustachian tube dysfunction D. Otosclerosis. The correct answer. Continue exploring more MCQs on chronic suppurative otitis media. Question 11. What is a typical symptom of tubotympanic CSOM? A. Painful ear discharge B. Foul-smelling ear discharge C. Bloody ear discharge D. Watery ear discharge. The correct answer is B. Foul-smelling ear discharge. Question 12. The presence of granulation tissue in CSOM suggests A. Healing phase B. Chronic inflammation C. Active infection D. Tympanic membrane regeneration. The correct answer is C. Active infection. Question 13. Which part of the ear is usually involved in adicoantral CSOM? A. Eustachian tube B. Posterior canal wall C. Pars tensa D. Pars flaccida. The correct answer is D. Pars flaccida. Question 14. Which of the following is not a typical complication of CSOM? A. Mastoiditis B. Brain abscess C. Otosclerosis D. Facial nerve palsy. The correct answer is C. Otosclerosis. Question 15. Which antibiotic class is commonly avoided in CSOM due to ototoxicity? A. Penicillins B. Aminoglycosides C. Cephalosporins D. Macrolides. The correct answer is B. Aminoglycosides. Question 16. The primary aim of surgery in CSOM is to A. Improve hearing B. Stop discharge C. Remove infection D. Reconstruct the ossicles. The correct answer is C. Remove infection. Question 17. Which test is primarily used to assess hearing loss in CSOM? A. Rinez test B. Weber's test C. Audiometry D. Tympanometry. The correct answer is C. Audiometry. Question 18. CSOM with cholesteatoma can cause erosion of which ossicle first? A. Malleus B. Incus C. Stapes D. None of the above. The correct answer is B. Incus. Question 19. Which topical antibiotic is frequently used in the management of CSOM? A. Ciprofloxacin B. Amoxicillin C. azithromycin D. Erythromycin, the correct answer is A. Ciprofloxacin. Question 20. Which cranial nerve is at risk of damage in CSOM with cholesteatoma? A. Trigeminal nerve B. Facial nerve C. Vestibulocochlear nerve D. Hypoglossal nerve, the correct answer is B. Facial nerve. These questions delve deeper into the clinical aspects and management of CSOM, crucial for medical students and practitioners. Let's continue with more MCQs on chronic suppurative otitis media. Question 21. What is the primary cause of CSOM in developing countries? A. Genetic factors B. Poor hygiene C. Untreated acute otitis media D. Excessive ear cleaning, the correct answer is C. Untreated acute otitis media. Question 22. Which type of ear discharge is commonly seen in CSOM? A. Serous B. Mucoid C. Purulent D. Bloody, the correct answer is C. Purulent. Question 23. The most effective method to prevent complications in CSOM is A. Regular ear cleaning B. Early diagnosis and treatment C. Use of ear plugs D. Avoiding swimming, the correct answer is B. Early diagnosis and treatment. Question 24. Which of the following is a common sign of cholesteatoma in CSOM? A. Pulsatile tinnitus B. Dizziness C. Foul-smelling discharge D. Ear pain, the correct answer is C. Foul-smelling discharge. Question 25. CSOM primarily affects which age group? A. Infants B. Adolescents C. Adults D. All age groups, the correct answer is D. All age groups. Question 26. In CSOM, the tympanic membrane perforation is usually a self-healing B. Persistent C. Transient D. Rare, the correct answer is B. Persistent. Question 27. Which imaging is essential before surgery for CSOM with suspected complications? A. MRI B. Ultrasound C. X-ray D. CT scan, the correct answer is D. CT scan. Question 28. Which of the following is a typical presentation of a patient with CSOM? Sudden onset of symptoms B. Gradual worsening of hearing C. No visible ear discharge D. Normal hearing, the correct answer is B. Gradual worsening of hearing. Question 29. A common feature distinguishing CSOM from acute otitis media is A. Acute ear pain B. Presence of fever C. Persistent ear discharge D. Recent cold symptoms, the correct answer is C. Persistent ear discharge. Question 30. The initial assessment for a suspected case of CSOM includes A. Blood test B. Tympanometry C. Otoscopic examination D. Hearing aid trial, the correct answer is C. Otoscopic examination. These questions help further understand SOM's presentation, complications, and management. Essential knowledge for Yinti practice. Continuing with more MCQs on chronic suppurative otitis media. Question 31. Which bacteria are commonly associated with CSOM? A. Escherichia coli B. Pseudomonas aeruginosa C. Streptococcus pyogenes D. Neisseria gonorrhoeae, the correct answer is B. Pseudomonas aeruginosa. Question 32. Which of the following symptoms indicates a severe complication of CSOM? A. Mild earache B. Persistent cough C. Vertigo and imbalance D. Mild fever, the correct answer is C. Vertigo and imbalance. Question 33. Which feature is commonly seen in the ear examination of a patient with CSOM? A. Intact tympanic membrane B. Retracted eardrum C. Perforated tympanic membrane with discharge D. Bulging eardrum, the correct answer is C. Perforated tympanic membrane with discharge. Question 34. Which of the following tests is used to assess eustachian tube function in CSOM? A. Audiogram B. Tympanometry C. Valsalva maneuver D. Bone conduction test, the correct answer is B. Tympanometry. Question 35. What is the most common risk factor for developing CSOM? A. Ear trauma B. Eustachian tube dysfunction C. Allergies D. High altitude, the correct answer is B. Eustachian tube dysfunction. Question 36. Which condition is often mistaken for CSOM due to similar symptoms? A. Acute otitis media. B. Otitis externa. C. Meniere's disease. D. Otosclerosis. The correct answer is B. Otitis externa. Question 37. Which ear drop is contraindicated in CSOM with tympanic membrane perforation? A. Ciprofloxacin. B. Polymyxin. B. C. Gentamicin. D. Neomycin. The correct answer is D. Neomycin. Question 38. Which part of the mastoid is most commonly affected in mastoiditis due to CSOM? A. Antron. B. Air cells. C. Tegment tympani. D. Zygomatic process. The correct answer is B. Air cells. Question 39. The presence of a fistula in the ear due to CSOM typically involves which structure? A. Facial nerve. B. Cochlea. C. Semicircular canals. D. Stapes footplate. The correct answer is C. Semicircular canals. Question 40. Which of the following is a late complication of untreated CSOM? A. Otitis media with effusion. B. Cholesteatoma. C. Ear eczema. D. External ear infection. The correct answer is B. Cholesteatoma. What are the routes of intracranial spread of chronic suppurative otitis media, or CSOM? A. Troutman's triangle. B. Periarteriolar spaces of Fear-Carabin. C. Dural dehiscence. D. Dural venous sinus thrombosis. C. All of the above. The correct answer is E. All of the above. Chronic suppurative otitis media, or CSOM, can lead to serious intracranial complications if left untreated. Understanding the routes through which infection can spread to the brain is crucial for prevention and early diagnosis. Let's look at the possible routes. A. Troutman triangle. This is a triangular area in the temporal bone. It allows infection to spread from the middle ear to the brain, bordered by the sigmoid sinus, jugular bulb, and facial nerve. B. Periarteriolar spaces of Fear-Carabin. These are spaces around blood vessels in the brain. Infections can spread along these spaces to reach the brain tissue. C. Dural dehiscences. Thin or absent dura mater areas allow direct contact between the middle ear and the brain, enabling the spread of infection. D. Dural venous sinus thrombosis. Infection can spread along venous sinuses, leading to thrombosis or blood clot formation, resulting in inflammation. The correct answer is E. All of the above. All these pathways can allow CSOM infections to spread to the brain, causing complications such as meningitis, brain abscess, subdural empyema, and sigmoid sinus thrombosis. Early diagnosis and treatment are essential to prevent these severe outcomes. Let's dive into some key MCQs on the complications of chronic suppurative otitis media, CSOM. Question 1. Which of the following is the most common complication of CSOM? A. Meningitis. B. Mastoiditis. C. Facial nerve palsy. D. Brain abscess. The correct answer is B. Mastoiditis. Question 2. Which cranial nerve is most commonly affected in CSOM with complications? A. Trigeminal nerve, CNVB. Facial nerve, CN7. C. Abducens nerve, CN6. D. Glossopharyngeal nerve, CN9. The correct answer is B. Facial nerve, CN7. Question 3. A patient with CSOM presents with vertigo, sensorineural hearing loss, and facial weakness. What complication is most likely? A. Labyrinthitis. B. Petrositis. C. Cholesteatoma. D. Brain abscess. The correct answer is A. Labyrinthitis. Question 4. Which imaging modality is most useful for detecting intracranial complications of CSOM? A. X-ray. B. Ultrasound. C. CT scan. D. MRI. The correct answer is D. MRI. Question 5. The presence of a fistula in the lateral semicircular canal in CSOM is commonly associated with A. Mastoiditis. B. Cholesteatoma. C. Otosclerosis. D. Tympanosclerosis. The correct answer is B. Cholesteatoma. Question 6. Gradenigo syndrome is a rare complication of CSOM that primarily involves which cranial nerves? A. CNV and CN6B, CN7 and CN8C, CN9 and CNXD, CN3 and CN, where the correct answer is A. CNV, and CN6. Question 7. Which of the following is a life-threatening complication of untreated CSOM? A. Ear discharge. B. Meningitis. C. Tinnitus. D. Eustachian tube dysfunction. The correct answer is B. Meningitis. Question 8. Which complication of CSOM is characterized by inflammation and infection of the mastoid air cells? A. Otitis externa. B. Mastoiditis. C. Tympanosclerosis. D. Otosclerosis. The correct answer is B. Mastoiditis. Question 9. Brain abscess in CSOM patients most commonly occurs due to spread of infection through A. Blood vessels. B. Eustachian tube. C. Bone erosion. D. Direct contact. The correct answer is C. Bone erosion. Question 10. Which of the following complications of CSOM presents with headache, fever, and altered mental status? A. Mastoiditis. B. Labyrinthitis. C. Brain abscess. D. Cholesteatoma. The correct answer is C. Brain abscess. These questions cover the critical complications associated with CSOM, highlighting the importance of early diagnosis and management. Let's continue exploring more MCQs on the complications of chronic suppurative otitis media, CSOM. Question 11. Which complication of CSOM involves the spread of infection to the dura mater? A. Brain abscess. B. Meningitis. C. Subdural empyema. D. Epidural abscess. The correct answer is D. Epidural abscess. Question 12. Which of the following indicates a poor prognosis in CSOM? A. Mild ear discharge. B. Persistent headache. C. Gradual hearing loss. D. Tinnitus. The correct answer is B. Persistent headache. Question 13. A child with CSOM develops fever, ear pain, and post-auricular swelling. The most likely diagnosis is A. Otitis externa. B. Mastoiditis. C. Petricitis. D. Labyrinthitis. The correct answer is B. Mastoiditis. Question 14. In CSOM, the presence of granulation tissue in the middle ear is most commonly associated with A. Otosclerosis. B. Tympanosclerosis. C. Active infection. D. Cholesteatoma. The correct answer is C. Active infection. Question 15. Which of the following complications is characterized by the erosion of the ossicular chain? A. Tympanosclerosis. B. Cholesteatoma. C. Otitis externa. D. Mastoiditis. The correct answer is B. Cholesteatoma. Question 16. Which is a common cause of facial nerve palsy in CSOM? A. Viral infection. B. Trauma. C. Cholesteatoma. D. Meniere's disease. The correct answer is C. Cholesteatoma. Question 17. CSOM with intracranial extension can lead to which severe condition? A. Cerebellar abscess. B. Sinusitis. C. Pharyngitis. D. Tonsillitis. The correct answer is A. Cerebellar abscess. Question 18. The involvement of the sigmoid sinus in CSOM is referred to as A. Mastoiditis. B. Sinus thrombosis. C. Temporal bone fracture. D. Tympanosclerosis. The correct answer is B. Sinus thrombosis. Question 19. Which diagnostic test is best for detecting early complications of CSOM? A. Pure tone audiometry. B. Tympanometry. C. High-resolution CT scan. D. Otoscopic examination. The correct answer is C. High-resolution CT scan. Question 20. Which of the following symptoms in a CSOM patient indicates a possible complication? A. Mild earache. B. Clear ear discharge. C. Persistent dizziness. D. Intermittent tinnitus. The correct answer is C. Persistent dizziness. These questions help in understanding the critical complications associated with CSOM, emphasizing the need for timely intervention and management.